the word health promotion or promoting health is increasingly used by architects to brand their buildings. So our new hospital is health promoting. And I was very curious what health promotion actually means and why it was different than, for instance, healing or healthy architecture. So I did this literature review to understand what health promotion means for healthcare architects or in relation to healthcare architecture research. And it showed that there's many different interpretations actually to what health promotion means. Often it's used without any clear definition, and it's not referring to existing health promotion frameworks that we know of from public health, for instance. And when it's being mentioned, it's often relating to either healthy behavior or health equity or accessibility or salutogenics, but seldom combined. So it's very focused on either or and never in a combination thereof. And at the same time, I've been relying on, in my research, on the definitions of health promotion as proposed by Green, which is more common in public health research. So in my PhD, I also tried to figure out if I could revise my definition of what health promotion is. So health promotion, according to the WHO, is the process of enabling people to increase control over, improve their health. And it moves beyond the focus of individual behaviors towards a wide range of social environmental interventions. So in my own definition, which is obviously very building upon that, I define health promotion as the process of enabling vulnerable individuals, so more paying attention to this equity component, individuals and populations to increase control over factors that positively, and I added the positive because that sort of underlines the salutogenic component, not just focusing on illness prevention, but more on the positive components, and including their living environment, so where people stay. The WHO identified several main settings that should incorporate health promotion, including home, hospital, school, community, workplace. The Handbook of Settings-Based Health Promotion, it's a relatively new book that also indicates per different setting what health promotion could mean. So when we focus on health promotion in hospitals or in healthcare services, there is sort of a distinction that we could make. We are already going to the transition to more healthy healthcare, where it's not just about treatment of disease, but it's about medical care of patients. So it's a more person-centered focus. But still, this healthy healthcare is very much focused on prevention, pathogenic focus. So looking at the causes of illness and looking at risk groups. Whereas now what we're trying to do is to move towards this health promoting healthcare, where the health of all building users, but also the local community and the planet is considered. So what then is healthcare building design? And I think that for me, healthcare building design is that you create healthcare environments for health promotion, and thereby you foster positive health, quality of life, healthy behaviors such as sleep, movement, social interaction, but also fostering equity and participation for all kinds of users, and with a particular focus on marginalized communities. And we already know from the previous webinars that the built environment influences our health, right? There is different types of design features, so architectural, so how the layout of the building works, or what kind of furniture is used that affects health outcomes of different types of populations on different healthcare settings. And based upon my PhD research, I have developed a model to sort of understand the different components to that. So first of all, the circles, they kind of represent, like, is the focus of the healthcare organization and the building design, is it focused just on patients, like the darkest circle, or is it looking to the range of building users, so staff and visitors as well? Is it looking maybe at the community, so the environment, the people that live around, or is it also looking at the planet or the environment? And then the circles, they have different pieces of the pie, you could say, and one side represents a more pathogenic focus. So for instance, how can the building support cure, rehabilitation, disease prevention, or health protection? Whereas the other side of the circle, which is more the salutogenic and I would say health promotive side of things, is what is focusing on well-being, healthy behavior, health equity, and for empowerment. And after my PhD, I've also sort of mapped all different kind of existing design approaches to this dimension. So for instance, there's terms such as healing design, restorative design, supportive design, which very much fits on this cure rehabilitation component. So where there's stress reduction, etc. Or there's safe design, which is very much focused on avoiding people falling or adding handrails, but also avoid spread of this infection, etc. This is an example where the design supports the quality of life and well-being by North Architects. It's a Center for Cancer and Health, and it's already indicating the focus on health in its name. It's small scale and next to a major hospital. There's no treatment in this building. Instead, there's a focus on well-being of people with cancer, but not calling them patients and their relatives, but also for staff to relax and retreat. And this building, it doesn't have a reception, but it has a kitchen and a long dinner table. No waiting rooms, but a living room with space for book clubs and a place where people can feel safe to take off their wig, for instance, if they've lost their hair due to cancer treatment. It's often a place where they can meet people in the same situation without being pressured in the waiting room, waiting for cure, but in a more relaxed environment. It's another example of this outdoor care retreat by Snoetta Architects. It's also focused on design for well-being, but you could also relate it to inclusive design or biophilic design. It's a very small pavilion in a small section of nature next to a hospital. It's very unmedical in a way, a lot of wood, natural materials, but also the cushions you can take off. So it becomes very playful. And you see also that the kids start to move more. This is another example where it goes well. So this is in Rotterdam, where you can see that the roof garden that they have created on the hospital allows also for people in beds to go there and rest and meet with family and friends outside of the wards. This is a good example of where inclusive design and active design can come together. And here you see the stairs, they are not as steep as normal. And then you can also see there's a double railings who has a strong contrast with the back material. So it's easy to see, but it's also double height. So you can choose what fits you best. But sometimes we think, okay, but this is it's not so difficult. And of course, in the regulations, it also needs to be accessible for people in the wheelchair. And I think that when we're talking about accessibility, it's often about being accessible for people in wheelchairs or strollers or that kind of mobility aids, but we don't really consider other types of diversities, for instance, visual difficulties, or maybe not being able to read or not feeling comfortable in a certain environment because it doesn't align with your cultural needs. The last example that I wanted to show is the example of Angered Närsjukhus. So Angered is a neighborhood in Gothenburg in Sweden, and Närsjukhus means nearby hospital or community hospital. It's a combination of that. And this hospital, it's in the middle of the neighborhood in Gothenburg with the lowest life expectancy. And it combines primary and secondary care. They initiated participation with the inhabitants or important spokespeople, and it became very clear that the people who lived there, they didn't want to have a hospital that looked like something that they were used to from home, but they wanted something that was very Swedish, because they argued that actually what combined or what brought all of these people together is that they now all lived in Sweden. And I think it's important to still work with like the current barriers to health promotion, and that's what we're also working on in the task force, of course. Go visit our YouTube, our LinkedIn, and our websites. We're so much focused on making all of this information and this knowledge accessible for people who are involved with that. I want to thank you for joining, and if you want to be involved in any way, please let us know. Thank you.